Healthcare organizations today, they're really at a crossroads, aren't they?
They absolutely are.
Facing this immense pressure, improve patient outcomes, sure, but also become incredibly efficient.
At the same time, yeah.
But the reality is, I mean, so many are still wrestling with systems that, frankly, feel like they belong in another era.
Definitely outdated.
Systems that just silo information, make it almost impossible to get that full picture of a patient, and they don't really empower patients, to engage with their own care.
Exactly. Engagement is key.
So the question isn't if they should transform digitally, it's more about how fast they can adapt before getting left behind.
It's become a necessity, not an option.
And that brings us right to the core of today's deep dive. Salesforce Health Cloud.
Mm-hmm.
Now, this isn't just some generic CRM tool with a healthcare label slapped on it, right?
Not at all.
It's purpose-built, a healthcare-specific platform designed really from the ground up to help providers, payers too, fundamentally rethink how care is delivered and managed.
That's the goal. And our mission today, really, is to give you a shortcut to understanding this pivotal shift.
Okay.
We're going to dive into what makes Health Cloud, unique, explore how it directly supports these crucial goals, like the big move towards value-based care.
Right.
And critically, talk about the vital role that implementation partners, folks like Cabot Technology Solutions, play in actually making this digital transformation work in the real world.
Okay, let's unpack that. We talk about legacy systems struggling, but why exactly? What's the most critical reason current healthcare IT systems are buckling under today's demands? Where do they fall short?
Well, the fundamental issue really is that these older systems, think EHRs, billing systems, all these different third-party tools, they just weren't designed for the complex patient journeys we see now.
Journeys that are way more complicated than they used to be.
Absolutely. Think about it. Patients interact in person, sure, but also telehealth, remote monitoring, even, asynchronous messages back and forth. These legacy systems, they create isolated pockets of data, islands of information, which leads to incredibly manual, inefficient coordination across different care teams. It's like trying to build a puzzle with pieces that don't quite fit together.
That makes perfect sense. And okay, beyond the operational headaches for the providers themselves, what about the patients? What are they expecting from healthcare tech today? Because I imagine their expectations have shifted quite a bit.
Oh, dramatically. What's really fascinating is that patients today expect the same kind of seamless experience they get from, say, online banking or retail.
Yeah, that seamlessness.
Exactly. Easy appointment booking, proactive communication about their care, not just reacting to problems. They want visibility into their care plan. They're looking for that consumer-grade experience.
Which traditional healthcare IT often doesn't deliver.
Right. It often falls short.
Yeah.
So when you boil it down, healthcare organizations need a platform that can do several key things.
Right.
Centralize all that disparate data. Enable real-time collaboration across those fragmented teams we mentioned. Engage patients across all these different touch points. Scale easily, whether you're one clinic or a huge network. And of course, stay rigorously compliant with all the regulations.
IPA, GDPR, all of that.
All of it.
And this is precisely where Salesforce Health Cloud comes in, positioned as that flexible, cloud-based foundation designed to tackle these exact needs, helping organizations deliver, truly connected, patient-first care.
That's the idea. Patient first.
Now, what really distinguishes Health Cloud, because, some might think, oh, it's just CRM adapted for healthcare, but you said it's purpose-built. What does that mean in practice? What are the unique capabilities?
Yeah, that's a really key distinction. It's not generic. Health Cloud combines the power and flexibility of the core Salesforce platform, which is significant, but then layers on functionality specifically designed for healthcare's unique complexities.
Okay.
Let's start with maybe the most foundational piece. The 360-degree patient view.
Right, the holistic view.
Exactly. And this goes way beyond just basic demographics or a list of conditions. Imagine a single screen where a care team instantly sees, yes, the clinical stuff, labs, meds, history, but also non-clinical data. Critically, this includes social determinants of health.
Things like housing, transport.
Exactly. Housing stability, transportation access, food security, things outside the clinic walls that massively impact health outcomes. It also pulls in behavioral data preferences, how they've engaged before, integrations with devices, wearables.
Like heart rate monitors, glucose meters.
Yep. And even insurance and claims data for the financial picture, all accessible in one place. It just makes making well-informed decisions so much easier. It's really a paradigm shift for delivering truly holistic care.
Having all that rich data in one spot is huge, but it's only really powerful if the whole care team can act on it right together in real time.
Absolutely. Data's no good if it's not actionable.
And that's where Health Cloud's real-time collaborative care coordination comes in, I assume. How does it enable that?
Precisely. It lets organizations assign different team members, PCP, specialist, social worker, case manager, whoever's involved, to each patient's care team within the system.
Okay.
And the power comes from features like shared care timelines, so everyone sees the plan. Automated workflows and task assignments, so things don't get dropped.
No more sticky notes.
Hopefully fewer. Plus, crucial alerts and reminders for things that need attention, and that cross-team visibility, so everyone's on the same page. No more critical steps falling through the cracks, ideally.
Can you give an example? Make it concrete.
Sure. Let's say you have a diabetic patient who misses a key primary care visit.
Okay.
The system flags this. The care coordinator gets an alert right within Health Cloud.
Immediately.
Pretty close to it, yeah. And from there, they can easily follow up, maybe schedule a quick telehealth check-in, see if they're sticking to their medications, all managed and tracked within that single platform. It shifts follow-up from being reactive to proactive.
That real-time coordination, it sounds incredibly efficient. Building on that, what about the customizable care plans and protocols? How flexible are those? What kind of impact do they have?
They're really flexible. Health Cloud lets you tailor these plans precisely, either to an individual patient's specific needs or based on established clinical guidelines, using structured templates you can reuse.
So you're not reinventing the wheel each time.
Exactly. And these plans can include concrete milestones like complete follow-up blood test within 14 days, specific activities, schedule nutrition counseling, links to educational resources, and clear assignments for who on the team does what and by when. It's super useful for managing chronic conditions, behavioral health support, complex post-discharge planning. It really moves away from that one-size-fits-all approach.
Okay, so we've talked a lot about empowering the providers, the care teams. What about the patient? Because like you said, patients expect to engage on their terms now.
Absolutely. The patient experience is central.
Which brings us to Health Cloud's multi-channel patient engagement. How does it actually connect with patients where they are?
You've hit on a critical point. It's all about omnichannel communication, meeting patients on the channels they prefer.
Right.
So Health Cloud supports a whole range. SMS texts, email notifications, secure in-app messaging via patient portals.
Like MyChart, but integrated.
Sort of, yeah. Integrated into the whole experience. Plus direct phone and video integration for telehealth. And even AI-powered chatbots for handling common questions, self-service stuff. These tools automate a lot of the outreach, send crucial reminders, appointment reminders, medication reminders, and importantly, keep a complete record of all that communication right in the patient's profile. So there's continuity.
And here's a little bonus insight for you listening. When you integrate Health Cloud with something like Salesforce Marketing Cloud,
which is a common integration.
Right. Organizations can launch these really targeted health campaigns. Think seasonal flu shot reminders tailored to specific patient groups or invitations to wellness programs. All done while, crucially, respecting patient privacy rules. It's a powerful combo.
Definitely. Now, beyond managing interactions and plans, there's also robust analytics and reporting.
Got to measure what you manage.
Absolutely. Health Cloud provides these customizable dashboards and reports. They help leaders clinical and administrative monitor everything from patient engagement trends. Are people actually using the portal to care plan completion rates? Are we hitting our milestones? Plus population health insights, workflow performance, and those vital compliance metrics we talked about.
Okay.
But what's truly advanced here, and really it's a game changer, is layering in Salesforce Einstein AI.
The AI piece.
Yeah. This isn't just looking backward at data, it's predictive. It can forecast patient risks like who's likely to be readmitted. It surfaces next best actions for the care teams, suggests intervention points based on patterns it finds in the data.
So like a warning system.
In a way, yeah. For instance, a hospital system could use this to track readmissions among, say, heart failure patients. The AI might flag individuals showing early warning signs, allowing the team to proactively intervene with home health services before a crisis hits. That's the power turning data into foresight.
That foresight is invaluable. Now, let's clarify something important. Health Cloud complements, it doesn't replace existing core systems like the EHR or billing platforms, right?
Correct. That's a common misconception.
Yeah.
It works with them.
So how does it integrate? How seamless is that connection with all those different systems healthcare organizations already have?
It's designed for integration. Health Cloud fully supports key industry standards like FHIR, and HL7.
The languages of healthcare data exchange.
Exactly. Those are the crucial standards that let different systems talk to each other securely. So Health Cloud can exchange data with major EHRs, Epic, Cerner, Allscripts, MedTech, plus health information exchanges, lab systems, pharmacy systems, even custom-built internal systems. And this, again, is where partners like Cabot Technology Solutions play such a specific, critical role. They're experts at building those custom connectors and secure APIs needed to really bridge the data flow smoothly between Health Cloud and everything else, making it all work together seamlessly.
Makes sense. You need that specialized expertise. Now, security and compliance, non-negotiable in healthcare. What's built into Health Cloud to protect data and meet regulations?
Paramount, absolutely. It's built with security at its core. You've got data encryption, both when it's stored and when it's moving. Field-level access control so only the right people see specific information. Detailed audit trails.
So you know who did what, when.
Exactly. Role-based visibility, sophisticated tools for managing patient consent, and of course built-in support for those essential compliance frameworks. HIPAA in the US, GDPR in Europe, FHIR certification readiness. It's designed for this regulated environment.
Okay. And finally, let's touch on scalability and flexibility. What does that mean for an organization, maybe one that's growing or dealing with changing patient needs?
It means Health Cloud is designed to grow with you. It scales pretty effortlessly. It doesn't matter if you're a small community clinic just starting out or a huge multi-state hospital system. Organizations can configure different modules. Maybe they need provider relationship management or better care plan tools or utilization tracking. They could add users easily as their teams grow. They can launch new workflows, new programs, often without needing complex coding.
Configuration, not just code.
A lot of it, yes. And it can be localized for different regions, different languages, different specialties. It really adapts.
And circling back to AI, just to reinforce it, all of this is enhanced by that built-in AI and automation with Salesforce Einstein. It sounds like it's not just bolted on, it's really woven through the platform.
It truly is. Einstein is deeply integrated. It enhances so many capabilities. Scoring patient risk, like we discussed.
Yeah.
Suggesting the next follow-up activity for a care manager. Surfacing predictive insights, who's likely to miss an appointment, who might end up in the ER. And even powering smart triage tools to help teams prioritize their workload effectively. It's all about enabling smarter, faster, more proactive decisions across the board.
Okay.
So if you connect all these dots, all these features, the 360 view, the collaboration, the engagement, the AI, it enables this fundamental shift.
Yeah.
Moving away from that old model, reactive, fragmented care, towards something proactive, connected, truly patient-centric, all on a secure, scalable platform that can evolve. It's about bringing healthcare operations into the modern digital age.
It really does feel like a significant leap forward, especially compared to where many organizations still are. So thinking bigger picture, what does all this mean for the healthcare landscape overall, especially with this ongoing shift away from fee-for-service?
Yeah, that shift is key. What's fascinating is how naturally Salesforce Health Cloud aligns with that move towards value-based care, or VBC.
Where outcomes matter more than volume.
Exactly. VBC models reward quality and efficiency, putting pressure on organizations to improve outcomes and cut down on unnecessary costs or utilization. Health Cloud directly supports this in several ways.
How so?
Well, first, population health management. We touched on this, but it lets organizations segment their patient populations by risk level, by condition, so they can do proactive outreach to the groups that need it most.
Targeting interventions.
Precisely. Second, preventive and chronic care programs. It helps design and run scalable programs for things like COPD, diabetes, heart failure. Care teams can track patient progress against milestones, get alerts if someone's falling behind.
Keeping people healthier out of the hospital.
That's the goal.
Yeah.
Third, care gap closure. Using automation and AI, it helps identify and close those gaps in care, like missed screenings, vaccinations, necessary follow-up visits, and helps the team take action quickly. And finally, real-time metrics tracking. This is huge for VBC.
Yeah.
It lets organizations measure the KPIs that are actually tied to their value-based contracts. Things like hospital readmission rates, patient satisfaction scores, utilization rates, makes them visible, actionable. It drives accountability and ultimately better outcomes.
You've laid out a really powerful case for Health Cloud's capabilities. It sounds great on paper. But for an organization thinking about this, it's a big investment, a big change. What are some of the hurdles or complexities they might hit during implementation? It's not just plug and play, right?
Well, absolutely not. You're right. It's not just flipping a switch. While Health Cloud is incredibly powerful, its real impact, the actual value you get, depends heavily on how well it's implemented, customized for your workflows, and integrated into your existing tech stack.
Yeah.
And that's where organizations often face challenges. Things like migrating historical data cleanly and securely, integrating smoothly with those tricky legacy systems, getting all the different users, doctors, nurses, coordinators trained and actually using it effectively, and of course, maintaining that strict compliance throughout the process.
So it takes careful planning and execution.
Definitely. And this is exactly why partners like Cabot Technology Solutions are so important. They bridge that gap.
Okay, so Cabot acts as that crucial link between the powerful platform and the specific, often unique needs of a healthcare organization. What makes their approach stand out?
I think it's their deep expertise in both sides of the coin, healthcare technology and Salesforce development. That dual understanding is critical.
They speak both languages.
Exactly. They understand the clinical workflows, the operational challenges, and the technical capabilities of the Salesforce platform. They don't just install software, they strategize with the organization.
And their services seem pretty comprehensive. Can you walk us through the specific ways they help organizations navigate this complex implementation journey?
Sure. It typically starts with discovery and strategy. Really digging in to understand the organization's specific goals, workflows, pain points, and figuring out how Health Cloud can best address them.
Tailoring it from the start.
Right. Then there's custom development. Sometimes the out-of-the-box features aren't quite enough, so Cabot builds custom dashboards, specialized workflows, or specific features, often using Salesforce's Lightning components to make it a perfect fit. Their integration services are vital, connecting Health Cloud securely to those EHRs, billing systems, lab systems, using standards like FHIR and HL7, or building custom APIs if needed.
Getting the data flowing.
Crucial. They also handle data migration, which can be tricky, ensuring all that historical patient data gets moved over accurately and securely. They provide thorough training and support to make sure everyone knows how to use the system effectively. User adoption is key.
Can't skip the training.
Definitely not. And finally, they offer compliance oversight. They understand PAR, GDPR, and other regulations deeply, ensuring the implementation meets all the requirements.
Okay.
And Cabot's experience isn't limited to one type of organization. They've worked across the board, large provider networks, insurance payers, home health agencies, specialty clinics. They bring that breadth of real-world knowledge from different parts of the healthcare ecosystem.
So they've seen it before.
They've likely seen scenarios very similar to what a new client is facing. And just to really underscore this point, digital transformation in healthcare, it isn't just about buying new software. It's truly about creating these connected ecosystems that put the patient right at the center. Salesforce Health Cloud provides that essential infrastructure needed to bring it all together, the data, the people, the processes, in one unified platform.
Yeah, brings it all together. And to recap Health Cloud's strengths then,
Right.
it really supports that real-time collaboration, enables personalized patient engagement, which is so key today, aligns perfectly with those value-based care goals, and offers that scalable operation for organizations of any size.
Well summarized.
And the value of partnering with someone like Cabot Technology Solutions seems immense. You're not just getting a tech vendor, you're getting a strategic ally. Someone who understands both the complex technical side and the equally complex clinical realities of making Health Cloud work effectively.
That partnership is often the difference between success and struggle. So maybe here's a final thought for you, the listener, to consider as we wrap up. How will this increasing focus on personalized, proactive care driven by platforms like Salesforce Health Cloud fundamentally change your own experience, either as a patient yourself or maybe as a caregiver for someone else in the coming years? What new expectations will you start to have for your healthcare providers once this level of connected, informed care becomes the norm?